PGY1. The intern. 3:47 in the morning. A man in room 412 has been your patient for 46 hours. You took his history Tuesday afternoon. You wrote his admit orders. You ran a code on him at midnight that ran for 28 minutes. The senior resident called time of death at 3:43 a.m. and walked out of the room. You stayed. You wrote the note. You signed it. Your name is the name on the death certificate the nursing supervisor will hand to the family at 6 a.m. You walk to the resident lounge. You sit on the couch. You eat a granola bar from the basket the program apparently does not know exists. You go back to your pager. There are 9 new patients on your list. This is intern year. This is the first death on your signature. Every American doctor has a version of this story. The hospital, the hour, the room, the granola bar.
What no one tells you at the white coat ceremony, and what no medical school admissions interview will spend more than a polite minute on, is that this morning is the first of approximately 2,700 days that are going to remake the person who chose this. By the end of those days, depending entirely on which specialty board exam you sit, you will be one of 7 different broken kinds of person. I want to walk every one of those trajectories, by specialty, not by year, because residency is not one ladder. It is 7, and each one bends you in a particular direction. Internal medicine. Internal medicine is the broadest training pipeline in adult medicine. The categorical residency runs 3 years. Pay during PGY1 sits around $65,000 to $70,000 depending on the city. Hours are governed by the Accreditation Council for Graduate Medical Education's 80-hour work week rule, enacted in 2003 after the Libby Zion case and the New York Bell Commission report of 1989. The rule is honored in the breach. Run the math on that on any internal medicine wards rotation in any major academic center in the country. You are the doctor managing 5 to 20 patients on the floor service at any one time. You round in the morning with an attending who has 40 years of practice and 1 minute per patient. You read studies on your phone in the elevator. You learn how to write a note in 9 minutes. You learn the cadence of family meetings when there is no curative option left. You memorize the difference between dressing the wound and dressing the death. 3 years in, the change is quiet. By PGY2, you have stopped sleeping the way civilians sleep.
By PGY3, you have made the decision about which subspecialty fellowship to pursue, and that decision will compound for the next 30 years. You apply for cardiology, gastroenterology, hematology-oncology, pulmonary critical care, or you walk into a hospitalist job at $300,000 to $340,000 and a week-on, week-off schedule that the financial press will tell you is generous. Your spouse, by now, has either learned to manage the family without you or has left. The Medscape National Physician Burnout Report for 2024 put burnout among practicing internal medicine attendings at roughly half. The number does not capture what burnout means after 15 years. General surgery. General surgery is the 5-year categorical, sometimes 7 with research years, for academic positions.
The PGY1 intern year in surgery is what physicians from other specialties point to when they want to explain to a non-medical audience what the system is. 80-hour weeks are the regulatory ceiling. Per ACGME logging, surgical interns at major academic programs routinely report compliance violations buried inside shift swap arithmetic. Read the contract, then read the actual schedule. You stand in operating rooms for 10-hour cases. You hold a retractor for the first 3 hours. You are not allowed to talk. The attending who teaches you has been awake since 5:30. By PGY3, you are the chief of trauma overnight in a level 1 center. By PGY5, you are the senior in any room you walk into.
including rooms where the patient is dying on the table at 3 a.m., and the decision about whether to convert to a damage control laparotomy is yours alone for the 7 minutes it takes the attending to drive in. What you give to surgery is structural.
The marriage that did not survive PGY2 was not the marriage that was going to survive. The back pain at 34 is permanent. The drinking pattern the program tolerates because the chair drinks the same way is the drinking pattern that becomes a problem at 46. The Tate-Shanafelt studies out of Stanford have, since 2012, repeatedly placed surgeons among the highest physician burnout cohorts in the United States. The pay at attending in private practice can reach $400,000 to $700,000 by the late 40s. The pay is also, by then, paying for 2 divorces and an arrhythmia. Emergency medicine. Emergency medicine is a 3 to 4 year program depending on the hospital model. You work shifts. The promise to your spouse at PGY1 is that this will mean a predictable schedule. The promise is technically true. The schedule is brutal in its predictability. 8 to 12 overnight shifts a month, weekends, holidays, every other Christmas for the rest of your operational career. You see 2 to 4 patients per hour at a community shop, higher at urban Level 1 centers. You see them for an average of 12 minutes each. You disposition them within an hour. You will, over the course of PGY1 alone, see roughly 4,000 patients. You will, over the course of a 30-year career, see north of 120,000. A meaningful percentage of those patients are dying. A subset of them die in front of you. Listen to the room at 3 a.m. on a Saturday in any major metro emergency department. That sound is the moral injury of the specialty. Moral injury is the term the literature now uses. Wellness surveys are tracked annually, and emergency medicine has placed at the top of the Medscape burnout scale for the past 5 years running. Dr. Lorna Breen, an emergency medicine director at New York Presbyterian Allen Hospital, died by suicide on April 26, 2020, during the first wave of COVID. The Dr. Lorna Breen Healthcare Provider Protection Act was signed into law on March 18, 2022. The Act funds mental health resources for clinicians. It does not change shift volume, patient density, or the moral weight of triage at scale. In 2019, I sat in a teaching hospital ICU waiting room for 3 days. The resident I spoke with on the first morning had been on a 30-hour shift and was back on a fresh 30-hour shift on the third morning. She did not look tired in any way I could have named at the time. The focus she had at 7 a.m. on day 3 I have only seen since in long deployment combat veterans. I asked her how often she slept. She said, enough. If you want the rest of this ladder, and the 8 others coming up in this batch, the subscribe button puts new videos in your feed on the days I publish. No notification spam. The medical residency series will continue. The next ladder after this one is the music industry from the label side, not the artist side. This is the parallel that keeps surfacing across these institutional ladders. The way medicine and federal law enforcement and elite military selection all capture 28-year-olds who are the strongest, smartest, most committed people in their cohort. They put them through 8 to 15 years where the only way out is through. At the end, the body has been rebuilt around the institution. The institution does not see this as cost. The institution sees this as load testing. Nobody at the ACGME, nobody at the Bureau, nobody at any selection cadre will tell you out loud that the structure works because it breaks people. They will tell you it works because the people who survive it are exceptional. Both can be true. Only one of them goes on the brochure. Psychiatry. Psychiatry residency is 4 years categorical. PGY1 is medicine and neurology intern blocks. You learn pharmacokinetics. You learn medication interactions. You learn what an inpatient psychiatric ward at 3 a.m. looks like when a patient who has been on the unit for 9 days decompensates
and there is only one resident in the building. By PGY2, you are running the call shift. By PGY3, you are doing outpatient clinics and learning therapy modalities. By PGY4, you are choosing between consult liaison, child and adolescent fellowship, addiction medicine, geriatric, or going straight into community practice. Secondary trauma is the clinical name for what builds up over those 4 years. The patients you see have histories that you read in your charts and carry with you for the rest of the day.
The pediatric sexual abuse case at 3 p.m. on a Wednesday. The combat veteran with refractory PTSD on Thursday morning. The 14-year-old anorexia patient whose parents you cannot reach. You learn what your supervisors call countertransference. The good ones teach you how to feel something appropriately without taking it home. The bad ones teach you to feel nothing at all. She knows. She's known for 2 years. The psychiatry resident at PGY4 who has not had a meaningful date since intern year, who has a therapist of her own and has had one since PGY1, who is good at her work and will probably stay good at her work, knows that the field she chose because she wanted to help people is also the field that asks her to absorb the worst of what people do to one another for 40 years. Anesthesiology. Anesthesiology is a 4-year residency, including a clinical base year, followed by 3 years of clinical anesthesia. You learn to deliver and titrate the most lethal medications in routine clinical use. You learn to maintain a human being in a controlled physiology state for hours. You learn to do this 20 or 30 times a week for the rest of your career. You learn the cadence of the operating room. You learn that the anesthesiologist is, by training and by temperament, the doctor in the room who is paid to assume the worst. You also have, in the physician health literature, historically among the highest rates of substance use disorder of any medical specialty. The mechanism that the peer-reviewed studies in anesthesia and analgesia have documented over the past 15 years is access. The controlled substances of routine anesthetic practice are within arm's reach during every shift. The AAMC and the American Society of Anesthesiologists have spent 20 years building drug diversion monitoring programs in response. What the access represents is the larger thing. Don't have language for it yet. The first time a patient codes on your watch is not the worst thing that has happened to you in residency. The third time is. By the 7th time, the architecture of your week is built around recovery from the work, not enjoyment of the rest of your life. You do not call it that. You call it decompression. You drive home at 6 p.m. You pour the first drink at 6:03. Diagnostic radiology. Diagnostic radiology is a 4-year residency, typically preceded by a transitional year, so most radiologists spend 5 years post-medical school in training. The day is spent in dark rooms in front of monitors. You read CT scans, MRIs, plain films, ultrasound. You dictate findings into a microphone. The transcription becomes the chart note. The chart note becomes the patient's record. The patient becomes a number you have rendered a verdict on without ever having met. You will read between 60 and 120 studies on a typical day in an academic center. At a busy private group in PGY5 or in early attending years, that number can exceed 200. The pay at attending is well compensated. Interventional radiology subspecialty can push above $500,000 by the late 40s. The cost is that you spend 45 working hours a week alone in a dark room. The patient interactions you trained to have in medical school no longer exist. Depersonalization arrives by stealth. You write a report on a 50-year-old female with newly discovered metastatic pancreatic cancer at 10 a.m. and a report on a 6-month-old with interception at 10:15. There is no order to the queue. There is no buffer between findings. The Shanafelt data places radiology year over year in the middle of the burnout ranking. The middle position deceives. Burnout in radiology presents differently than in surgery or emergency medicine.
It presents as a man who can no longer remember what made him interested in medicine in the first place. Family medicine. Family medicine is the 3-year residency that builds the generalists who hold the United States primary care system together. Around 3,000 graduates enter the workforce annually, against an AAMC projected shortage of more than 30,000 primary care physicians by 2036. The math has been clear for 15 years. The compensation gap with subspecialty medicine has only widened. The training is broad: outpatient primary care, obstetrics in some programs, pediatrics, geriatric medicine, behavioral health integration. You spend PGY1 through PGY3 in continuity clinics, where the same patients come back every 3 months. You build the relationships internal medicine attendings on the academic side do not have time to build.
You see the entire arc of a chronic disease. You see the way the system fails patients you have known for 2 years before you finally lose them to a complication that a better insurance policy would have prevented. You absorb structural failure for a living. You did not break the patient, you inherited the patient, broken. The medication that costs $150 a month is not in the formulary, and the substitute does not work as well for this person. And you have argued with prior authorization on the phone for 40 minutes this morning between 2 visits. You do not have a name yet for the specific quality of fatigue this produces. The fatigue has a sound. It sounds like a printer running. PGY1, 3:47 in the morning. A man in room 412. Your signature on the death certificate. The granola bar in the lounge. PGY3 or 4, depending on specialty. You have stopped sleeping the way you used to sleep. You have stopped having dinner conversations about anything that happened at work. You can no longer remember the name of the resident who shared call with you for the first 6 months of intern year. The marriage that started in medical school is either still intact through unusual discipline or has ended quietly. The cohort of 150 doctors you graduated medical school with has, by the most recent published cohort tracking, lost some to suicide, at rates documented above the general population baseline. The rest are working, attending, 45 to 55 years old. Compensation has hit the number medical school admissions told you it would. The number is paying for the back surgery, the second cardiology consult, the marriage counselor, the kids' college tuition you came back from a half day of clinic to write the check for. You are good at what you do. You have rebuilt yourself around the institution that asked you to rebuild yourself around it. You are exactly where the system intended to put you. Nobody put that part on the brochure.